Hey everyone, this is Jocelyn, pelvic floor physical therapist and founder of the Vagina Doc. And in this video, I'm going to talk about why you would do the hip abduction screening test and what that would show if theoretically this were an MRI. So the reason why I am doing this video is because recently I had posted a test that probably routed you to this video on a substitute for an MRI that could actually tell you more than an MRI. So let me tell you a quick story and to give you some context of why this is important and how this is all related. So I was having issues with numbness and tingling, mainly tingling, which are called in the medical world paresthesias, down my leg, like from the knee down into my feet, pretty intensely if I got into certain positions. So and it was both sides. So depending on the position of my hip, either my left or my right, if it was in a certain degree of hip flexion, hip rotation, it was like within 30 seconds, my whole leg was just this like tingling instrument. It was crazy. And so this was really bothersome for me because this is a position that I had been getting into for teaching classes, so my work, as well as positions to treat my patients. So I was a PT student at the time and I had good insurance. So I figured I'd go have a consult about it. And they're like, well, sensation, we better do an MRI because potentially you have something growing or impinging the nerves. Weird because it was both sides at the level of in my lower back. Well, here I am thinking, well, are you going to put me in an MRI with my hip in a certain position that brings on my symptoms? Well, obviously not. So I get the MRI and I'm laying on my back and I never have symptoms laying on my back. And lo and behold, my MRI shows a little arthritis in my low back. And other than that, the discs look great. The nerves look great. So nothing was found. They didn't do any pelvic MRI or hip MRI. So the whole point there was like, these images are static images of a regular MRIs, it's just a static picture of what they're looking at. And there is so much data that shows that people with symptoms have negative MRIs and people that don't have symptoms have positive MRIs for things like rotator cuffs, hip pathology, knee pathology. It's low back pathology. It's really alarming because the society as a whole really we think that these images have the answer to our why we're having pain, and they don't often. Our physical exam as healthcare providers hold a lot of valuable information because we can actually examine the thing that is a problem. So why did I choose? How does this relate to the tests that I put up and the tests that you'll see me put up in the near future? Well, for example, let's say, and someone had asked me to put like what an MRI would come up, what it would look like. And that was I'm really glad that she had asked me that because these are potentials, but this is what I would expect. So why I chose this specific test is because this muscle, when it is not functioning properly, can be a contributing factor of hip pain, of pelvic floor dysfunction, of back pain, low back more often, sacroiliac joint issues. So I'm going to combine that with low back pain and knee pain. Those are the things that I see most often. So let's say this person has hip problems, let's say hip pathology. They think it's their hip joint, which wouldn't really present on the outside. But anyways, could. Let's say they're like, I have hip pain and I really want an MRI. And this is where it hurts. They're pointing to the side of the hip. And I'm like, okay, thinking about what would an image show? This image may show inflammation of the tendon or of the bursa of the hip. So the tendon being the part where the muscle turns into a connective tissue that attaches to the bone. Inflammation. So it's irritated. But it doesn't. So it tells me the symptom, but it doesn't tell me why. This is why this test is so freaking powerful, because this test identifies, well, clearly you have inflammation because you can't even hold your hip up. And if that reflects, so the powerful part is what I'm just going to say, that reflects what I see being the primary issue in their movement. So if they're walking and I see that their hip is dropping every time they land and it's just a snap and it's just like constant yanking on the tendon. So the tendon is taking the brunt of the problem and not the muscle. The muscle's just like on vacation. That is what I'm talking about. Now let's say it's the low back. The path of least resistance is typically what moves easiest. And I will say hormones are a driver here. So glute, like side hip pain, is not uncommon in women that are transitioning in their life, whether it's childbearing years, hormones are fluctuating, or going into menopause. So, okay, let's go back. Low back pain. Why? How would this affect the low back? All right, when someone takes a step and their pelvis should be level, and let's say when they step on the right leg, the left side drops like this. Well, not only does that yank on the tendon on the right side, but it also like impacts a person's back to be like rocking back and forth. So their back bothers them. Well, that in an they're like, oh, I need an MRI. Well, the MRI is probably going to show arthritis and degenerative changes with the disc. That's across everyone. I mean, that's what happens when we age. We use our bodies. And a lot of people abuse their bodies without knowing it unintentionally because they're doing a lazy walk all the time, or they're not exercising, or they're not utilizing their stabilizers. So their back joints take most of the brunt. So whether that's what the MRI is going to see, it's going to see degenerative changes. And, you know, I've seen the most horrific x-rays, horrific MRIs, and a person doesn't have symptoms. So, and then I've seen MRIs where I'm like, they're not bad at all, and the person is having a lot of symptoms. So the MRIs aren't helpful. It says, okay, maybe there's irritation here, maybe, but it doesn't tell the story. The story can then, what the story is all right, the person says, this is painful, this movement, whether it's sitting, standing, transitioning. And then I take that story and I'm like, I pick it apart. Okay, what are they missing here? Oftentimes I'm like, okay, this muscle is not performing. I'll do the test that I showed you and they can't do it. They compensate in their back or they compensate in their elsewhere. And that tells me the medication that needs to be prescribed. And it's not narcotics. It's not tramadol. It's not this or that. It is movement and impairment and tissue resilience training. That is why this test is so powerful. So regardless of what the MRI shows, it's just telling me the source of the symptoms, not telling me nearly about the cause. So I hope this sheds some light. I know I didn't have any models, but I wanted to get this out there because while you guys are going through this video, it's really worth your while. This is just one of these list of so powerful tests out there. And that's probably why I don't make money, because all the things that I can do is free, whereas an MRI is big bucks and I don't benefit from an MRI. But anyways, if you have questions or you want to talk about this further, please leave it in the comments. I am not against MRIs. I'm not a huge fan for MRIs of a lot of things, particularly related to like repetitive injuries and so on. I mean, they're really, really imperative for a lot of things, such as acute injuries. I mean, I had an MRI when I blew my knee to pieces. There was no way that I needed an MRI there. People need them like when they have really like they weren't injured and then there was an instance that is serious, they could benefit from one. And then also ruling out what we like to call red flags, like masses, tumors, those things that are not PT or musculoskeletal neuromuscular problems. All right, guys, I'll see you on the next video. If you like what you're watching, if you like what you're hearing, please subscribe to the channel and join the private education community. I'll put the link in the comments.